I'm Tina.
And I'm Jenna, and we're registered respiratory therapists with Pulmonary Wellness. And today we're going to guide you through the active cycle of breathing technique. The active cycle of breathing is a gentle breathing technique to help loosen mucus in the lungs, move it up, and get it to the point where you can effectively clear it in a nice, cool, calm, and controlled way.
Active cycle of breathing is one part of a mucus clearance plan. So work with your healthcare providers or the respiratory therapists at Pulmonary Wellness to find out if it's right for you. You can do the active cycle of breathing sitting up in a chair, on a couch, or maybe at the edge of your bed. Let's get started.
The active cycle of breathing technique has 4 main steps. The first step is all about breath control. This is your simple pursed lip breathing. The second step is about thoracic expansion. These are bigger, deeper breaths. The third step is we go back to pursed lip breathing or simple breathing. And then the fourth step is we end in a huff, which helps to move the mucus. You cycle through these steps and we'll gently guide you through one full round together.
All right, let's start with breathing control. Breathing control are nice, relaxed, gentle breathing. Take a resting position, sitting up tall, keep your shoulders relaxed. There's no rush, lots of room for that belly to move. Maybe we'll place one hand on the chest and one hand on the belly. Sometimes we find that this helps. Breathe in gently through your nose and breathe out slowly through your mouth using pursed lips. Continue this breathing for 20 to 30 seconds or until you feel that your breathing is nice and settled.
Let's do the second step, thoracic expansion. So these are the deeper breaths to help get air in behind obstructions in the airways of our lungs, like mucus plugs. We're going to take a slow, deep breath in through the nose, and this time we're going to feel our ribs really expand. We can hold that breath in for 2 to 3 seconds, but only if that feels comfortable for you. And then you can gently exhale through your pursed lips fully. So we aim to do about 3 to 5 thoracic expansion breaths at your own pace. Let's do 2 breaths together. If you feel lightheaded or dizzy, stop the deeper breaths and just come back to your simple pursed lip breathing.
After you've done 3 to 5 of these thoracic expansion breaths, we're going to come back to the normal relaxed breathing, the breath control. So let's do another 2 breaths of breath control together. These are regular sized breaths in through the nose and out through your mouth using pursed lips. The final step is called huffing or a huff cough. A huff cough lets you move the mucus out without the need to use that strong, harsh cough. A huff is like fogging up a mirror. It's a soft H sound. So to do the huffing technique, we'll take a medium-sized breath in through the nose, and then we'll exhale forcefully with an open mouth. If you notice that your mucus feels deeper down in the chest, you can use a deeper breath in with a longer huff, like this. If you notice that the mucus is higher up in your chest, you can try taking shorter, sharper huffs like this. You can do about 1 to 2 huffs per cycle before returning back to the start of the cycle and doing the controlled breathing. Let's do a couple of huffing coughs together.
Okay.
Huffing breaths. Here we go. Breathing in. One more. If you notice that the mucus is ready to come out after your huffing, you can bring it up with a gentle cough into a tissue and take note of the mucus, how much there is, and what its consistency and color is.
This is one full cycle of the active cycle of breathing. Good job! You can repeat this cycle 2 to 4 times depending on how much mucus you have. Remember to always finish with the relaxed, simple pursed lip breathing or breath control breathing, just to make sure that things feel calm again. The active cycle of breathing technique should feel effective but not exhausting.
If you're not sure if the active cycle of breathing is right for you, speak with your care providers and learn how it fits in with your overall mucus clearance plan. You can talk with a respiratory therapist or one of the RTs at Pulmonary Wellness. Thank you for breathing with us today. Now get out there
And live your best lung life.